it's really important that people with asthma actually use their inhalers correctly. So for children particularly, asthma is not rocket science, it's just getting the steroid, your preventer, in properly and using the reliever, the blue inhaler, properly when it's needed. Children tend to benefit mostly, as do most adults, but by particularly using the aid of a spacer. These ones are pretty small, they are easy to carry around, they'll sit in the school bags. It's always useful to have a couple of spacers, so they've got one that they can leave at school and one that they've got at home. For a spacer like this, it takes all inhalers that are this type of shape. This is called a metered dose inhaler. Prior to using it, the spacer needs to be washed. We recommend that we wash them once a month. Just wash them in normal fairy liquid. Don't rinse them, don't dry them, just let them dry by themselves. And that's because they get a lot of static in them, and the medicine, the inhaler, the properties that come out of it will stick to the sides of the inhaler, the chamber, as opposed to coming out and going to the lungs where we want it to go. We shake your inhaler to start with, just so that the particles get all evenly distributed. You push it in. There's only one way that this can fit, and you put it close to the patient's mouth, and as we put a press down, okay, and then we just do 5 nice steady breaths. If you breathe out, that's it, and then suck in. Okay, and again, and again, and again. Good. Okay, and with that, generally make sure that you've got a good seal with the face mask. Obviously now, Ellie at this stage could probably move on to the next size chamber really, and perhaps try without the actual mask. Okay, so that's how you tend to use inhaler with a spacer. The other one that she's got, this is a dry powdered inhaler, it's a turbo inhaler, and this works on a twist. Generally we have what I call an in-check dial device that will show me just how much people are breathing in when they're using inhalers. Ali's just checked with this, and I can see just from where my red dial's gone that she's able to use this turbo inhaler properly. She's got enough breath to breathe in, so that's really important. This is really important particularly with old people and people who've got quite poor breathing problems, because they won't have enough inspiration to actually breathe in. Okay, so we're going to take a breath out first again to empty the lungs. Good girl. Long steady stuff, that's it. Keep going, keep going. Good girl. Then we're holding the breath counted gently for 10 seconds. Okay, and relax.